If vital signs slow you down on NCLEX, this video will change how you think. Most nursing students panic when they see abnormal numbers. But NCLEX does not test numbers. NCLEX tests patterns. Today, you will learn how to read vitals fast using one simple rule. Trend is more important than a single number. Why students struggle with vital signs? Students are taught normal ranges. Heart rate, blood pressure, respiratory rate, temperature, oxygen saturation. So when one number is off, they panic. They think, this must be the answer. That is how students get tricked. NCLEX does not reward reaction. NCLEX rewards clinical judgment. What NCLEX actually cares about? NCLEX is not asking, is this number normal? NCLEX is asking, is this patient getting better or worse? That is why trends matter more than single numbers. A single abnormal value may be expected. A worsening trend is dangerous. The fast rule to remember. Here is the rule. Say it with me. Trend beats snapshot. Always. What a single number is. A single number is one reading. One blood pressure. One heart rate. One oxygen saturation. By itself, it tells you very little. What a trend is. A trend is change over time. Numbers moving up. Numbers moving down. Numbers staying the same when they should not. Trends predict deterioration. That is why NCLEX loves them. The 3-step vital sign scan. When you see vitals, do this fast. Step 1, look for the trend. Step 2, match the trend to a body system. Step 3, ask the safety question. Let's break this down. Step 1, look for the trend. Ask yourself, are the numbers rising? Are they falling? Are they stable? Do not analyze yet. Just observe movement. Quick example. Heart rate 88, 89, 90. That is a trend. Upward. That matters. Step 2, match trend to body system. Now ask. What system is being affected? Heart rate affects circulation. Blood pressure affects perfusion. Respiratory rate affects oxygenation. Oxygen saturation affects oxygen delivery. Temperature affects infection and metabolism. Example. Respiratory rate 18, 19, 20. This is respiratory distress. Even if oxygen saturation looks okay. Step 3, ask the safety question. Now ask the most important NCLEX question. If I do nothing, what happens first? This question decides priority. Why single numbers trick students? NCLEX uses single numbers as traps. A blood pressure of 150/90 may look scary. But if the patient is stable, it may not be urgent. A blood pressure dropping from 120 to 90 is far more dangerous. Context matters. Trend mean more than single number. Let's practice. Example 1, heart rate. Patient A. Heart rate is 110. No previous data. Patient is talking. Comfortable. This may not be urgent. Patient B. Heart rate 82, 83, 84. That is a worsening trend. Patient B is higher priority. Example 2, blood pressure. Blood pressure is 98/60. Single reading. Patient is asymptomatic. Versus. Blood pressure trend. 130/80. 110/70. 90/58. This trend suggests shock. Trend wins. Example 3, oxygen saturation. Oxygen saturation is 92%. Single number. Patient with COPD. This may be expected. Versus. Oxygen saturation trend 96, 97, 98. With restlessness. This is respiratory compromise. Respiratory rate, the most important vital. Respiratory rate is the most ignored vital. And the most important. NCLEX loves respiratory rate. An increasing respiratory rate is often the first sign of deterioration. Always respect it. Example. Respiratory rate 16, 17, 18. Even if oxygen saturation is normal, this patient is declining. Mental status plus vitals. Vitals must match the patient. If vitals change and mental status changes, that is an emergency. Example. Heart rate rising. Blood pressure dropping. Patient confused. This is poor perfusion. Act immediately. Temperature trends. A single fever may not be urgent. A rising temperature with tachycardia and hypotension is concerning. Think infection. Think sepsis. Common NCLEX traps with vitals. Trap 1, focusing on one abnormal number. Trap 2, ignoring trends. Trap 3, not matching vitals to symptoms. Trap 4, assuming stable means safe. Select all that apply questions and vitals. On select all that apply questions, each option must improve safety. If vitals show deterioration, choose actions that address that trend. Ignore options that delay care. NGN case study thinking. On Next Gen NCLEX, vitals appear over time. NCLEX expects you to compare values. Look for worsening trends. That is where points are earned. NGN practice scenario. Patient is 72. Vitals. Heart rate 90, 91, 92. Blood pressure 118/76, 104/68, 92/56. Patient is restless. This is circulatory collapse. Trend tells the story. Pediatric and OB note. In pediatrics, small changes matter more. In pregnancy, normal ranges shift. Always consider the population. Trend still matters most. Timing rule. Reading vitals should take seconds. Scan. Spot the trend. Move on. If you are stuck analyzing numbers, you are doing too much. Final mindset shift. Do not chase numbers. Follow patterns. Safe nurses watch trends. That is what NCLEX rewards. Final takeaway. Trend beats single number. Always. Scan vitals fast. Identify deterioration. Protect the patient. Subscribe to NCLEX Decoded. Comment below, trend over numbers. Let's keep decoding the NCLEX.